Live again.
Hey guys, come on in. Now doing the FX CO2 laser resurfacing, and I'm following a very specific pattern. This is an area where he has a lot of acne scars, so I'm spot treating the area. Now some people, especially with like ethnic skin tones or darker skin tones, we're gonna get little streaks, kind of lines and squares from this. That's why we do these peels before and after our treatment. These will occur over the first 2 to 3 weeks and then slowly go away. He's doing really good with the pain of the deep. This is 0.12 millimeter in depth, which is why when you look at these, you can't really see it a ton. But you can tell that there's a lot of deep swelling. This is going to give him a little more of a long-term outcome. We're going to do the active FX in a minute, which is going to give him more of the short-term outcome, superficial peeling. What are they saying? Anything? Okay, well, he has deep acne scars. We've already done the Bella fill. We've already done subcision. Now we're working to resurface. And we're going pretty deep. Doing really strong because I know he really wants a big treatment.
Can you do microneedling with PRP for this?
With this or for acne scars?
With this.
Yeah, you could. We just don't need to. We just did Actora needling.
Doing PRP for healing.
We will be using PRP for him to heal afterwards. He will be doing a very specific skincare protocol with stem cells and growth factors, Emerald Skin, Refit Face, Anti-Age Serum. Let's have him turn all the way left. Perfect. See, it's always good to leave a little bit of spacing when you're going this strong on somebody.
Can you do this if you still have active acne?
You can, but it's not as recommended. If you have active acne and you want to get rid of the acne before you start to laser strong like this for scars, you'd want to use some different lasers to improve the active acne and a little bit of scarring. He's doing amazing, you guys. Really amazing. So we did nerve blocks and pills 15 years ago when I first started doing this. We did only topical. Could you imagine the pain? So you're doing...
Do you do a lot of Bella fill? Do you see complications with this product like I've seen on Real Self and other sites?
No, I don't really, to be honest. And I use it for penile rejuvenation. You guys know my patients love to get bigger and better. So we're using it for the penis as well. Look at that swelling, you guys. Look what I see this right here? That's called dewdrop on a rose petal. You see that right there? What does that mean? That means that not a rainy day on the plants. This means that we went really deep in the skin and he's so swollen, the serum is coming out.
What is the downtime for this?
A week to 10 days, guys. Now that dewdrop on a rose petal is very good, but it also means you better do your aftercare. Otherwise, you're going to get hyperpigmented and not get a good result. So he already looks good. We got to make him look better. We don't want to cause any increased risk for him. So we're going to use Emerald Skin Refit base and eye. We're going to use Hyla B. We're going to use Aox C for healing, Anti-Age MD, all from emeragecosmetics.com. He's going to use retinol, and he's going to do enzyme polish, skinzyme. There's a whole protocol I have called the ablative laser protocol. So now what I'm going to do, let's switch sides, give him ice pack. Ice pack over there. Hold on. We're going to cool that dewdrop down right there. Hold there. We're going to turn him. Perfect. And now we're going to work on this side. So while I keep going, you can ask me questions. Whatever you need, Jordan.
You use a lightening agent with this to prevent hyperpigmentation.
Yeah, we just said that, guys. So go back on IGTV.
A lot of people do.
And also go to emeragecosmetics.com and get the Enlighten, Aerify, or Cosmolon peels. You can use these before. We have a whole protocol of what to do before lasering. Gotta do that before you laser. Otherwise, you're going to get hyperpigmentation. You don't want that. So this is going to help some of those fibrous papules. Those are those little bumpy bumps that you get on the chin from acne. Okay, we don't want those. And I would expect, just so you guys know at this strength, that it's going to look a little blotchy when this peels. But then he's going to use retinol and hydroquinone. He's going to follow my Cosmolon 2 protocol. He's going to use custom dose. You guys know what custom dose is. That's our customized serum with TXA, kojic acid, retinol. It's going to be great. So he's going to do phenomenal. You guys see, he's going all the way in. Perfect.
Are you a plastic surgeon?
No, I'm a board certified dermatologist, guys. It says it everywhere. My website, Real Self, Yelp, everything.
So you do have plastic surgeons you do work with.
We have multiple plastic surgeons that work with me. We do breast augmentations, tummy tucks, revision surgery. So that's it for Deep FX. I'm going to finish this up. And then we're going to go live with Active. If you want to keep going, Jordan, you can. What?
There's a lot of people joining us. Let's stay.
Oh, if they're joining, let's stay then. So what I expect from this, you guys, and I'll show you in a minute, is a lot of swelling. Minor pinpoint bleeding, though. Why? Why do you get more bleeding when you do profractional? Watch out, Jordan. When you do profractional versus CO2. Does anyone in my room here know? Why do I get more bleeding with profractional and not CO2? Sorry, phone a friend. Phone a friend. He said, is the erbium laser going deeper? And I said, no. The CO2 is more hot, so it coagulates the blood vessels. The erbium's a cool laser, so it doesn't coagulate blood vessels. And what does that mean? Blood spurts everywhere.
Is that a trick question? Why did you have it on coax setting?
Well, that's... Don't go into that detail, PJ, but that is true. If you set it to C1, 2, or 3, this is for advanced training sessions, then you'll bleed less, and less. Good job, PJ. You could be a doctor. PJ went to the Google MD School of Medicine and the Jason Emer Fellowship. Emer Academy. Exactly. So you guys, what do you need to have when you have acne scars? Patience. It takes time. No, he's doing great. He's doing really great. Okay, let's turn him. Hold on.
Show them what we're doing.
I'm going to turn you a little bit more. Let's get the cooling on there. I got it. Hold on here. You're gonna see there is a little bit of spacing. Now, with CO2, you get more skin tightening than you do with erbium, than you do with non-ablative lasers. If he was an older woman with a lot of loose skin, hold on, I can't see, move that. Good. The CO2 at this level would actually tighten the skin.
Someone wants you to talk about CO2 versus profactional.
Well, I just did. I literally just did. That's
That's
hilarious.
400 people.
You guys, I just said that. You'd have to come and consult with me. Appointments at jasonemermd.com. Regardless, erbium's a cool laser and CO2 is a hot laser. You're gonna get much more out of this. He is pre-treated with a lightening and exfoliation peel in my full protocol on skin lightening at emeragecosmetics.com.
Does this reduce pores?
A little bit, but this is more for scars. Pores are permanent, guys. You can't get rid of pores. You can make the appearance of them less by doing some lasers and doing a lot of Aerify peels. Aerify every 2 weeks, your pores will look so smooth.
What is the aftercare like?
Email us at appointments@jasonemermd.com and we will give you a full protocol. Or you can go to emeragecosmetics.com and go to the ablative laser package. And it is on there, emeragecosmetics.com, ablative laser package. Email Lindsay at jasonemermd.com. She will do a consult with you and get you the skincare.
Someone's saying our patient is sweaty.
No, that's dewdrops on a rose petal, guys. That's the swellingness from the laser.
Will he be peeling from this?
Oh yeah, peeling. He's gonna be, his whole face is gonna be burnt off. And it doesn't look like much is happening right now, but you get ready for day 3.
What type of maintenance and laser treatments and how frequently in the future?
You take a look really quickly here. Hold on. Maintenance, he's gonna do 8 weeks. Another laser treatment and some more Bellafill if needed.
Could you do this to someone with a beard?
Yeah, but then you're gonna burn the beard. So you can. It's not gonna help with the scars if they have a beard. If you have a beard, you better shave.
Can you tell everyone what we did before this slide, before they tuned into this?
Yeah, so we did Subcision, Bellafill, Fractora, and TCA Cross. This is perfect. And now we're doing the CO2. Are you okay? You're doing okay? Next part, our last part, almost done. Now we're switching to the active. How are we doing on the viewership?
Huh?
How are we doing on the viewership?
We have 500 people happily watching you.
So we're gonna switch over, then I'm gonna stay on live. We're gonna cool him down a little bit while our team switches over now to the active. Some of the newer lasers, it's all embedded into one laser. Here it's 2 hand pieces, but I'll tell you it's the #1 CO2 right now in the world. Besides second is coming up is Deca. Okay, then number 3 is every other device. So I'm gonna cool him down right now. This will help kind of calm down
Is this treatment better than the Cosmolon peel?
Oh, he did the Cosmolon right before. That prepared him for this treatment. And you can take a look. Again, what did I tell you? When we go really deep, you don't get that much bleeding. Okay? We're calming him down. He's doing great. He's actually doing really, really good. We're going to do now the active. The active you're going to see much more because it's more on the surface. Will you come hold this? Over here. All right. So again, doesn't look like much happened. If you look really close, all those little dots just burned holes in his skin, you guys. So, hold it for a second. Hand this over to me. All right. Okay, now we're gonna go strong.
Hey, Dr. Emer, is it possible while on low dose Accutane to do CO2?
Yes, actually, you can do a very low dose.
Will the beard hair grow back if it's burnt off?
It will. So if I show you guys this here, look, the density is very high, about 80%, okay? If I drop it down, take a look, very little. You see all the spaces. He don't want that. He ain't got time for that. We need good ones. All right, so here we go. You can take that away now. All right, so now we're gonna start up here. We're gonna start down here. All right, so this is a pretty high density. We're gonna start now. I want to get him a really good result, so we're going really strong. He's gonna feel a little bit in some spots, you see? So, Nisha, if you can hold on his left side. So we're gonna try and coach him through. Some of this he won't feel, some he will. Are you doing okay? Okay, this is the final part, okay? So he's doing great. In the old days, we used to stick a little tongue depressor in here. And so you guys see how you see this much more. They're broader, 1.2 millimeter in diameter. So that's why it looks so tough. It's also why it's 10 times more painful. Painful, unfortunately, but 80% of its surface is going to be covered. It's going to radiate heat very deep, up to 2 or 3 millimeters. And the result's going to be phenomenal. What do we got?
People are commenting in different languages. People are loving it. They're asking what they're watching. You've got about 900 people.
This is Acne Scars, guys. We are doing CO2 laser resurfacing. I'm going to turn his head just a little bit. There we go. You're doing really good. I know you feel a little bit in some spots. You're doing great, though.
What is this treatment called and what does it do?
Tell them it's a combination of what?
It's the combination. We just did the CO2. We just did the other.
Loud. You're going to tell them loud. They won't be able to hear you.
We just did CO2 earlier. We did do subcision. We did the
Well, we did the
TCA.
deep CO2 first. Now we're on the superficial CO2. We did subcision, velifill, TCA, and fractura.
Yes, it's the laser resurfacing of the skin.
Now we're resurfacing. He's doing great. He's tough.
They put him to sleep. No, he's awake right now.
So just to do a shout out really here quickly, Innovative Optics. At Innovative Optics, I work closely with them to develop goggles. These are my Emer goggles right here. You can get them at Innovative Optics. Also, they have our Instagrams, if you guys take a look.
Someone said, better be someone rubbing his shoulders.
There is.
Let's see, we take the best care of people here.
Exactly. So he's about halfway done there. Now let's go to the other side. Perfect. We're going to the other side now. It should be hot again. He's doing really good. Again, look at all the dewdrops on the rose petal. Look at all that swelling, guys. I'm getting him through it. I'm getting him through.
Our patient is doing this for his acne scar, and that's why we're doing a lot of treatment on him today.
So, dab. Yeah, go ahead and dab all that. Get that dry. All this. Yep, not rub, dab. Yeah. Good. So, he's gonna feel this a little bit around the mouth. It's the only main area he'll probably feel a little bit more. Deep breath, okay? Deep breath here, deep breath. Good. All right, beautiful. The worst is done. He's going through the areas we have more numbing. Again, shout out to innovative optics, and my beautiful goggles, the Jason MRMD IG goggles. They're great for laser. Protects the eye. We don't want any burning of an eye. Okay, hold it. And turn your head right there. Good. And so CO2 laser is the most aggressive, or actually now the second most aggressive laser, or energy-based treatment for scars. J-plasma resurfacing or Renuvion resurfacing is the most aggressive. Cannot be used on his skin type, or shouldn't be. Also, he needs more deep resurfacing anyways. So this is more valuable for him than a dermabrasion or a Renuvion or a phenol peeling. What do we got on viewership?
You hit 1600.
1500?
Yeah.
Good. So you guys can see,
So they were air frying his skin.
this is controlled burn. It's very important you guys are using the right skincare and you do it on the right skin type. So you definitely want to make a skincare consult from emeragecosmetics.com, and you definitely want to follow my Emerage Skin Protocol and our ablative laser protocol. He's doing amazing. Now I can't wait to show you guys this transition daily, but that's the best part. Deep breath, deep breath. Good. This is the hardest area because there's no main nerve that's here. Remember, I did the zygomedical-temporal-facial nerve. Perfect. So we are frying and flying. That's what I used to call it when I was a resident. Now we're going to work our way on your forehead. We're going to the forehead now. Okay, you're going to feel a little maybe. This is the easiest part because all the main nerves are here. Plus his skin, look at his skin on his forehead, it's pristine. So it's going to look phenomenal when he's done. So what are they saying, Jordan? What are they saying over there?
What is happening? This is our CO2 laser resurfacing. We did the deep one earlier. This is the superficial on the top layer now.
Now we're on the more superficial layer, although the energy here is very high. And this is resurfacing. You see all this smoke coming up? That's dead skin cells coming up, being burned and going into the vacuum.
Can you explain to the viewers why CO2 fires the way that it does?
The pattern.
So CO2 is a CPG scanner. So you guys could see the little dots are going all over the place. That makes it so it's less likely for you to have squares and lines on the face, but also because it's fractional. Little areas are being spared. So it makes you heal much faster. In the old days, when I first started, we had only fully ablative lasers, and the downtime was much more, and people didn't get the same result. So it's firing in this pattern, hexagonal pattern, because it's the best pattern for blending. You can see what I call this feathering. We're almost there. He's almost done, guys. It's like the end of a marathon. Very excited for him. Okay, we're feathering. Now we're gonna go on the nose. We're gonna go on the nose. Gotta get rid of those pores, right? Okay, deep breath. You're almost done. Last part, okay? Final.
Almost done.
Final.
Almost done.
Sorry, sometimes it wears off a little bit on the nose at the end. This is it. Halfway done on the nose. Good. Okay, that's half done. Take a breather. Now we're gonna do the rest. Here we go, guys. Now we're gonna do the rest. Deep breaths. Okay, hold on. Take a breather.
2 more.
Last part.
Almost done, okay?
Here we go. 1 minute.
Almost done.
So now we're just blending everything, you guys. And then we're gonna let them cool off. We're gonna apply PRP. Good. Here we go.
Almost done.
Nose is the
Last
hardest. That's why I do it last.
Last
Good.
bit.
Hold on. Here we go. Last one.
One more. That's it.
Perfect. Good. All done. Just do a little on the forehead. Hold on. Okay, so now I do my last look, you guys, and I'm just gonna blend the eyes, and then he's done. Hold on. Perfect. Gotta make sure everything's blended. Great. Okay. So now we're gonna apply PRP for healing. Come take a look. I'm gonna take this off. He's all done. Keep your eyes closed, okay? And you can see all that swelling from the deep. See all that swelling from the deep. So let's apply PRP. Go and get the cooling mask. We're gonna apply PRP. This is growth factors from his own blood. This is gonna help him heal faster. He did great. Okay, we need to put this on right immediately. Okay, this goes into those charred areas and especially good for the deep FX, which was the deep laser. You okay? Good. He's okay, guys. He survived. I promise. I wasn't trying to hurt him intentionally. Put a little into the hair. I always put a little into the hair. PRP because it helps the hair. Okay. Perfect. Okay. Now he's also going to take some PRP home. We're going to apply cooling mask. Always pour a little bit of the cooling mask onto the skin so it's cold, nice and cold. Okay? So the skin gets cold. Okay, then we take our mask, which is biocellulose, calms everything down, and just cools him. He's gonna feel relief immediately. Get the air, cold air, please. Cold air, Zimmer. So now we're gonna give him a little bit of cold air, just to hold, not directly. Give that into his hand,
Right hand.
just so he doesn't get this to be too sticky. Just grab his hand, put that in there. Just use the cooling, okay? On your face. Use the air. Just lightly. Good. And that's it, you guys. So now you can take a pan. He did great. We'll do a testimonial in a minute. We'll do it in Spanish before he goes. And that's it. And then we'll watch him heal over the next few days. That was our CO2 laser combination, you guys. Thank you for tuning in. I'm super happy that you guys could see this. Bye.